Hey guys, welcome back to Betrayal of the Body. Nikita here, and today we're going to talk about my back pain. It's been plaguing me my entire life, so we're going to go into that. So when I went to see the geneticist, we had to go into not only my medical history, but my family's medical history pretty in-depth, even non-diagnosed conditions, but symptoms throughout their life. And so when I asked my mom about my personal medical history in regards to like my childhood and stuff, I asked her, how old was I when I started complaining about back pain? And she said as soon as I could talk. So that gives you an idea of how long I've been dealing with this. At about 11 years old, it got to the point where I couldn't sleep at night. I was screaming in pain from my back and hips. They were just killing me. And my mom took me to go see a doctor, and one doctor said I needed surgery, and so she freaked out, and she wanted a second opinion, and she took me to another pediatrician who said I was completely fine, and that this was all just normal, and I would grow out of it. And so, as a mother, she was just really concerned about back surgery, and that scared her, so she opted to lean towards the pediatrician who said that it was nothing and dismissed the pain, said that it would go away. So we went down that road. She took me to a holistic masseuse, and he practically did a readjustment, and that relieved a lot of my pain for several years until I was about 19 years old. During my second pregnancy, when I was 19 years old, I injured my back in a move, and I never really fully recovered from that injury. After that, I kind of had that dull aching that I used to have when I was a kid, and it just kept increasing over the years, but no one wanted to take it seriously. Everyone said it was muscle tension due to stress, and that I just needed to take a hot shower. No one ever did imaging, so I continued to cope with the pain. So a few years later, when I got cancer, I had multiple surgeries, then I went through chemo for endometriosis, and then I had the kidney bag for 6 months. All of these things did not do my back any favors, and my back pain at this point became constant, severe, and unbearable, really. I was just always in back pain, and the doctors at this point said that it was probably due to babying my back with the kidney bag, because I had a kidney bag on my left side, and so they said that I had messed up my alignment, and that's what the pain was. And now that the kidney bag is gone, I will naturally readjust my alignment, and that this should go away with time. Then, several years go by, I've learned to just live with this constant back pain, and my husband and I were moving from Colorado to California. I spent 3 long days in the car moving all of our stuff from one storage facility to another storage facility, and when we got done, I had a pretty severe seizure. And I ended up falling face forward into the couch, hyperextending my back and my neck, and continuing to seize that way for a few minutes. And when I came to from the seizure, there was no question I injured my back. It was very painful. I couldn't move. I was in tears. And so we made an appointment to see a doctor. New back in town, so my husband and I made an appointment with just a doctor that our insurance assigned us. We didn't really look into it. It was a clinic, and we both made an appointment because he had injured his back as well. So our appointments were a couple of days apart. I went in first, told the doctor that we had just moved, that I fell, and I injured my back. And I've been having, very severe back pain ever since. And I want to make sure that, nothing's serious, that there isn't something that needs to be done. And his response was that it's very common for women to experience stress-related muscle tension in regards to a move, and gave me the number of a psychologist in the area to help make this move easier for me, and a prescription of antidepressants for my pain. My husband goes in, sees the exact same doctor 2 days later, and he was told, he goes in, he says, I injured my back in a move. It's been hurting ever since. And the doctor says, don't worry, sir, we'll get to the bottom of this. And he orders an MRI. He gave him a prescription of both, I believe, Percocet and Tramadol to help with the pain. And he gave him a referral to physical therapy. I, of course, at this point find a different doctor. It took me about 6 months to find a doctor willing to even order imaging of my back. When they did, they found that I had scoliosis, kyphosis, and that I had a rotation in my lumbar spine, that I had narrowing, that I had osteopenia, which is I'll explain all these terms. And so they found all these things in the first set of imaging that this doctor ordered, and he says, okay, yeah, we found some stuff, but none of these things really are associated with causing any pain, and so I don't think that there's anything that we need to do about them. And I was like, well, I'm in back pain. I don't, maybe keep looking. I don't know what to tell you. My back hurts. And at the time, I was sitting like this on the exam table. And he says that no person with back pain has ever sat like that before. And I was confused. I'm like, well, it's not increasing my back pain. Like, I don't know what to tell you. Like, this is very comfortable for me. I can't compare myself to other back patients, but it doesn't hurt me to sit like this, and my back does hurt. So can you please keep looking? Took a couple more doctors before anyone took me seriously. The primary care doctor that referred me to my pain specialist said that he was humoring me by sending me to a pain specialist, but not to expect anything from them. And I got there and showed my pain specialist my records and my images, and he apologized profusely. He said that all of these things absolutely cause pain. And I began finally getting treatment for my back pain. So as of December 2016, my back diagnoses were scoliosis of the lumbar and thoracic spine, kyphosis of the cervical spine. I gotta reference the list, people. We got lumbar rotation, lumbar narrowing, osteopenia in the lumbar spine. We got lumbar sacral spondylosis, radiculopathy in both the lumbar spine and the cervical spine. And then in 2017, I gained diagnoses of degenerative disc disease and also bulging discs in several areas. There isn't much they can do for any of these diagnoses aside from very invasive back surgery that none of us really feel is necessary at this point. We tried physical therapy, which failed. Somehow it made my hip even worse. So all they've really been able to do is give me painkillers and help keep me comfortable. And then last week, we actually did a nerve root block. And that has had both positive and negative side effects. I noticed the very next day that my limp had almost completely disappeared, which was amazing. Not a lot of reduction in pain, which was what I was hoping for, but I guess my hips or leg is functioning better because I'm not limping as much anymore. But then I also have had what I call dead leg a couple of times, where my leg just doesn't respond when I tell it to move. It just doesn't move. And I've almost fallen a couple of times because of that, so that's kind of scary. So that's where we're at with my back so far. Please stay tuned for next week's video, which will cover my cyclical vomiting syndrome. Like, share, subscribe.